Hi, I'm Jason Gould from Chislehurst Chiropractic Clinic, and today I wanted to talk to you about some of the challenges you might have if you're working from home and if you're suffering from low back pain. Now, there's a number of different reasons why people get low back pain when they're working from home. It could be that you're bending and lifting and carrying, it could be that you're spending a lot of the time on the sofa, it could be that you've been spending quite a bit of time at your laptop, or you might have been doing a little bit of home DIY. Now, when the back starts to hurt, there's different things that can cause it. It could be a disc injury, and that pressure starts to build up, and with a disc injury, the thing that causes most of the pain is compression, and when that starts to happen, the nerve can get inflamed and irritated, and that can sometimes lead to sciatica. Other times you might have arthritic change in the back, and as the space gets narrowed around where the nerve is, it can get inflamed, it can get irritated, and that can sometimes cause some nerve pain, some numbness, some tingling, some pins and needles. So there's different things that may be affecting you right now. So what I was going to do is I was going to run through some key tips on things you can do to reduce your back pain, and also give you some exercises that would really help. So the first tip that I was going to share with you is, if you've been getting back pain, one of the things that you can do is you can actually stand on one leg. So if you're doing the ironing, if you're doing dishes, if you're standing brushing your teeth, if you stand on one leg, it can actually help take the pressure off your low back. Or alternatively, you can get a chair and just rest your knee on the chair. Now, by resting your knee on the chair, what that does is that can help to reduce the pressure on the low back, and it also limits the amount that you're bending. If you're at the sink and you're doing washing up and you're working in that respect, sometimes if you get a small step and you just put your foot on the step, again, that can take pressure off your back as well. So the exercises I'd like to share, I'm going to go through some specific key exercises as well. So the first exercise is core stability. Now, if you engage your core, what you want to do is you want to lie on your back with your legs bent and your feet flat on the floor, and you're going to pull your tummy in and start to engage the tummy muscles. Now, as you feel that contraction, you want to feel the back bracing. Now, what I find is when these muscles are weak, if your leg is extended too far out, you can start to get pressure, just like when you're bending as well. So if you pull your tummy in, lift your leg up an inch, and then slowly stretch your leg all the way out, you might start to feel a slight weakness. Now, if you come back into the position where your starting position, and try that again. And now this time, lift your leg up 1 inch, hold it for 3 seconds, and then slowly start to lower the leg, and then swap sides and lift the other leg. Now, you should try to feel that the effort is coming from the midline, so from the belly button, and the tummy muscles that you're engaging are core muscles that really can help stability. Another exercise that I love to recommend is an exercise where you start to work on your balance and positioning sense. Now, when you're working on your balancing and positioning, that's called proprioception, and that's the joint positioning sense that tells your body where your joints are in time and space. And the thing is if you've got a mismatching firing in this system, that's how you can sprain your back. You've probably heard the phrase, "my back just went." Well, often what happens is when somebody's going to bend or twist, and there's that moment of an acute sprain, or if they twist their ankle, that's often a lack of firing within the proprioceptive system and a lack of stability within the core muscles. So the way that you train this is we use our eyes, we use our joints, and we use our middle ear for balance. And so the idea is by standing on one leg and engaging your core muscles, you're actually training your proprioceptive system. Now, it's best done, if you've not done this before, if you use footwear like a shoe or something like that. Now, what that will do is that will help to give you stability. Now, to make it harder, obviously you could take your shoe off and be barefoot. To make it harder still, you can use a foam yoga mat or something along those lines. Now, when you're standing on one leg, the idea is you should be able to stand for 30 seconds. That's your pass mark. Now, if you can only stand for 3 or 4 seconds, don't worry. As you start to train this exercise, you'll find it gets better over time. So what I'd like you to do is stand up, stand with good posture, engage your core muscles by pulling your tummy in and making sure your shoulders are straight and your neck is in a good position, and then stand on one leg. Now, in that position, you might be able to feel the muscles working. Now, if not, what I'd like you to do is close your eyes. And as your eyes are closed, you should be able to find that you can feel the foot muscles and the core muscles working to stabilise. Now, the idea is if you do 5 sets or 3 sets of 10 or 5-second holds or 10-second holds of this exercise, and then gradually build up, increasing the time and increasing the length of time that you're actually doing this exercise for. It can be really, really beneficial. So that's the proprioceptive exercise. So often if you've been sitting too long, your hip flexors become too tight, your back muscles also become too tight, and then your core muscles, your tummy muscles and your glute muscles become too weak. And this creates what we call lower cross syndrome. Now, lower cross syndrome is an imbalance where you start to get pressure building up in the spine, and that can start to put pressure on the joints in your back, and it can start to cause weakness that can then lead to pain, and it can eventually damage a disc. So this exercise that you do is basically lying on your back, engaging your core muscles like we've done before, and then engaging your glutes, and then slowly, ever so slowly, just bringing your hips up into a position where you're holding that bridge position. Now, if you get a hamstring tightness or you start to notice a cramp, please stop this exercise. And the same goes for any of the exercises we've done. They should all be very gentle and very safe exercises. If you get pain during the exercise, that's not normal, so please stop the exercises and check with us. So in terms of the exercises, what I'd like you to do is to engage your core, lift yourself up into that bridge position, hold that position, and then start to engage your shoulders and start to slide your hands down towards your legs. And as you're sliding the hands down towards the legs, what you should notice is your palms are facing up to the ceiling and you're just tensing your shoulder blade muscles. So these exercises are really, really effective at helping strengthen and stabilise your low back. And if you'd like to make the exercise a little bit harder, you can always use a light weight like a medicine ball or even one of your little ones. And there's other ways that you can also make the exercise advanced by taking the light weight from one side to the other to really work the oblique muscles. The next exercise is one we call cat stretch, and cat stretch is from a 4-point kneeling position and then you slowly move down. Yoga calls this child's pose, very similar type of exercise, and basically what you're doing is you're going into a kneeling position to stretch the lower back out. And the next exercise is lying on your back, very similar to when you're doing the core exercises. This time you're going to push on your knee to give a little bit of resistance, and what that does is that helps to switch off or inhibit the muscle, which relaxes it, and that helps to take pressure off the low back. And this exercise is called piriformis stretch, and the sciatic nerve travels underneath piriformis, and sometimes when this muscle's tight and tense, it can also be contributing cause of some sciatic pain. So this stretch can sometimes really help to release piriformis muscle and open the hips up. I really hope that this exercise set has been really beneficial for you. If you've got any questions, please let me know, and obviously we'll do what we can to help. Thank you.